Hello, welcome back to Shrinked by Quint. Every week we delve into the intricacies of psychotherapy, dispelling myths and applying the latest research to explore a broad spectrum of mental health topics. My aim is to empower you with knowledge and insights to foster a healthier, happier life, because after all, your health is your wealth. Today, we're diving into a topic that's as relevant as it is debated: a comparison between psychotherapy and SSRIs as treatment options for depression and anxiety. When discussing mental health treatment, two of the most common options are psychotherapy and medication, specifically SSRIs, selective serotonin reuptake inhibitors. SSRIs like fluoxetine, Prozac, and sertraline, Zoloft, are often prescribed for conditions such as depression, anxiety, and OCD. Psychotherapy, often referred to as talking therapy, involves working with a therapist to explore thoughts, feelings, and behaviors, developing strategies for managing them. There are over 400 types: cognitive behavioral therapy, CBT, psychodynamic therapy, humanistic therapy, but today we'll focus on psychotherapy as a broad concept. These two treatments, psychotherapy and SSRIs, are often compared, but they aren't exactly apples to apples. They can be used separately or together, depending on the person's needs. But the big question is, how do they compare? Well, to begin, let's first look at how each treatment works. SSRIs target the brain's chemistry by increasing serotonin levels, a neurotransmitter associated with mood regulation. The idea is that by boosting serotonin, SSRIs can help alleviate symptoms of depression and anxiety. It's a biological fix, aiming to correct what's been seen as a chemical imbalance in the brain. As neurologist Sam Harris points out, the brain is a physical system, entirely constrained by the laws of nature. There is no magical self in the background pulling the strings. SSRIs work within this system, addressing chemical imbalances directly. However, as Dr. Roger Mcfillin has noted,
the promise of a pill is often more compelling than the reality. The best treatment is often the one that addresses the root cause of suffering rather than merely masking symptoms.
This sentiment is echoed by Dr. Anna Lembke in Dopamine Nation, where she observes, "We've all become primed for instant gratification and quick fixes, but long-term, healing often requires us to confront and work through our discomfort." Now, this for me underscores that while SSRIs can offer quicker symptom release, they don't always tackle the deeper, underlying issues. Psychotherapy, on the other hand, doesn't directly change your brain chemistry in the same way. Instead, it's about understanding the patterns in your thinking, behavior, and emotions, and making conscious changes that lead to a healthier, more balanced life. Carl Jung once said, "Until you make the unconscious conscious, it will direct your life, and you will call it fate." This highlights the role of psychotherapy in bringing awareness to these unconscious patterns. But here's the thing, both approaches have their merits and their limitations. Let's start with SSRIs. The major advantage of SSRIs is that they can be fast-acting, especially when compared to psychotherapy. For someone who is severely depressed or anxious, SSRIs can offer relief in a matter of weeks, which can be life-saving. Bessel van der Kolk emphasizes, trauma results in a fundamental reorganization of the way mind and brain manage perceptions. SSRIs can help stabilize these overwhelming perceptions. They're also convenient. Take a pill once a day, and you're good to go. For many, SSRIs can be an effective tool in managing symptoms that might otherwise feel overwhelming. But, yes, there's always a but, SSRIs are not a cure-all. For one, they don't work for everyone. Studies suggest that about 30 to 40% of people with depression don't respond to the first antidepressant they try. And then there are the side effects: weight gain, sexual dysfunction, insomnia, and emotional numbness, to name a few. Plus, SSRIs don't address the underlying issues that might be contributing to someone's mental health condition. This is where psychotherapy can really shine. Psychotherapy gets to the root of the issue. Whether it's unprocessed trauma, negative thought patterns, or unhealthy coping mechanisms, therapy aims to dig deep and address what's really going on. While it might take longer to see results compared to SSRIs, the changes made through therapy can be more sustainable in the long term. As Gabor Mate says, the attempt to escape from pain creates more pain. Psychotherapy offers a way to address that pain directly rather than just masking it. Think of it like this. If your house has a leaky roof, taking an SSRI is like putting a bucket under the leak. Yes, it catches the water and prevents your floor from getting soaked. Psychotherapy, on the other hand, is like hiring a builder to come in, assess the damage, and fix the roof. It takes more time and might be a bit more of a hassle, but in the end, you've solved the problem at its source. Of course, it's not always an either-or situation. For many people, the best approach is a combination of both SSRIs and psychotherapy. SSRIs can help stabilize your mood enough that you can engage more effectively in therapy. In turn, the insights and coping strategies that you gain in therapy can help you manage your symptoms more effectively, possibly reducing your need for medication over time. But there are also cases where one might be preferable over the other. For example, if someone has a mild form of depression or anxiety, they might opt for therapy alone, especially if they're wary of medication. On the flip side, if someone is in the grips of severe depression and can barely get out of bed, SSRIs might be a crucial first step to getting them to a place where therapy can even be an option. But now let's also touch on something that's often overlooked: personal preference. Some people are uncomfortable with the idea of taking medication every day, especially if they're concerned about side effects or becoming reliant on a pill. Others might be more comfortable with the idea of popping a pill than with opening up to a therapist. The key is finding what works for you, and that's often a combination of factors, including the severity of your symptoms, your personal beliefs, and your lifestyle. But here's where it gets tricky. There's still a lot of stigma around both medication and therapy. Some people feel ashamed for needing medication, while others might feel like they're failing at therapy if they need to take meds. Neither of these is true, of course, but it's a real challenge that many people face. So, how do you decide what's right for you? The best approach is to have an open, honest conversation with a mental health professional. They can help you weigh the pros and cons of each option, taking into account your specific situation and preferences. It's also important to remember that mental health treatment is not one size fits all. What works for one person might not work for another. Another important point is that you're not locked into one approach. If you start with SSRIs and they're not helping, you can talk to your doctor about adjusting your dosage or trying a different medication. If you start therapy and it's not clicking, you might consider trying a different type of therapy or a different therapist altogether. Flexibility is key. At the end of the day, whether you're leaning towards SSRIs, psychotherapy, or a combination of both, the goal is the same: to improve your mental health and well-being. Both approaches have their strengths, and neither is inherently better than the other. It's all about finding what works best for you and being patient with yourself in the process. Mental health is a journey, and sometimes it takes a bit of trial and error to find the right path, but the good news is that there are options out there, and there's no shame in using whatever tools you need to get better. So if you're considering therapy, medication, or both, take that first step. Reach out to a professional, ask questions, and explore your options. Remember, taking care of your mental health is one of the most important things you can do for yourself. Thank you for tuning in to Shrink by Quint. Remember, your well-being is the cornerstone of a fulfilling life, because your health, truly, is your wealth.